Connecticut has been particularly hard hit by the opioid epidemic, with a high rate of drug-related deaths across a relatively small state population. Since their electronic prescribing for controlled substances, or EPCS, requirement took effect in 2018, overdose ER admissions have dipped and opioid-related deaths have plateaued. We talked with Rodrick Marriott, the state's director of drug control, who was instrumental in creating an effective law that garnered wide buy-in from the medical community.
So we'd seen a couple of instances of prescription drug fraud with drug fraud rings that were potentially moving prescriptions illegally throughout our state, usually opioids. Our state pushed for an EPCS requirement to help make sure that we were preventing fraud and making sure that our prescriptions were getting to our pharmacies safely and without adulteration or alteration. So when we were crafting this law, we predominantly looked at New York's law. They were one of the first states to really do this. And so we had the benefit of learning from the struggles that they had. They were forced a couple times to extend their deadlines. And so part of that was the rigidity in which they provided the waiver.
State e-prescribing mandate waivers issued due to economic hardship or technological limitations allow prescribers to issue and pharmacists to dispense paper or oral prescriptions instead of e-prescriptions. Such waivers are typically good for up to 1 year.
So we wanted to make sure we had a robust waiver process that gave us enough flexibility to handle a lot of different situations. Because again, at the end of the day, we're here for patient care, they're here for patient care, and we want to make sure our patients are protected and safe, but also getting the medications that they need. Our legislators thought that it would be good to roll this out with a nice time window, to give us some time before the law went into effect. That allowed my hardworking staff to get out there and tell people in the field about this requirement. And it's really important that as this law was being written, the stakeholders had an opportunity to see and hear about it. And so if you can get some information out there and work with the different societies and the different stakeholders, you can really kind of help make that smoother. You know, as you start to look at the tools that we've deployed at times here, data is a huge part of it. And so EPCS data about the number of prescriptions that are going out also allows our healthcare entities to evaluate the way that their practitioners are prescribing to make sure that if there's some kind of a flag or concern about that prescription or that patient, it can be addressed. And it may provide more opportunities for patients to be identified, to get care or be referred to care. To get better information to our providers really allows them to make the best decisions for the best outcomes for their patients.